This is Joycey.
And Blake.
And welcome to Savagely Scaled, the podcast for the athletes who know that the loudest cheer in the gym usually goes to the person finishing last. So look, we spend a lot of time at the whiteboard talking about, CrossFit. And one of the biggest things we do talk about is core stability in the gym. So we buy the expensive leather belts, we do the hollow rocks, and we obsess over our bracing. But there's a part of your core, the literal foundation of your house, that most of us are completely ignoring until it starts screaming for attention. We're talking about the pelvic floor. So whether you've dealt with a little leakage on a heavy set of double unders or you've got hip pain that just won't quit, this episode is for you. And honestly, if you think this is just a women's episode, you're already behind the power curve. Men, listen up. This affects your heavy triples too. So let's get into it.
5, 4, 3, 2, 1.
Today we brought in the experts. Today we are joined by Carol and Andrea, who specialize in the pelvic floor health and therapy. We're really excited to learn from them and bring the conversation to our community because I know so many people kind of get embarrassed to talk about it, don't want to come in. So welcome to the show, ladies. I know, Carol, we've had you on.
Yes.
So welcome, Andrea.
Thank you.
So to start us off, can you both tell our listeners a little about yourself, like your background or what led you to like the pelvic floor therapy genre?
Okay, yeah, I'll go first. So I've been a therapist for 31 years now, and I was never interested in pelvic floor. And Andrea and I have worked together for quite a few years, and Andrea and I would have conversations such as like, I'm so glad there are people and therapists like you that want to do pelvic floor because I definitely don't want to do that. And we would laugh about it. And what really turned me, well, actually, Andrea one day kind of said to me, she goes, you might really like it if you got into, I'm like, I don't know. Yeah. So, anyway, I was coaching. I'm a CrossFit coach as well. And I was coaching, and in the middle of a class, one of the members came up to me and she was bawling, and I thought she had been hurt. And she said, Carol, I'm so embarrassed. I have to leave. I just peed myself and I don't know what's happening. That was like a turning point for me. It was a huge turning point. And like my heart ached for her because she was humiliated and it hurt my heart to see her. And she's somebody that I know well. At that moment I was like, there is not enough information. Like we as women and men shouldn't be embarrassed about this, but we are because of how society is uneducated about it. Right. So I think I went home. I either texted Andrea or I went home that day and I said, girl, I got to do something. I'm going to do pelvic floor because this shouldn't happen. She was, of course, excited. We went probably a couple months later and she went with me, took a course by the Institute of Clinical Excellence, which they're excellent, by the way. And it was a pelvic floor live course. I was like, this is the coolest thing in the world. This company that we take the courses from, they're very fitnessy oriented, which is great. It fits in with CrossFit, but they're also very, it's a company that's very good about really teaching us to help others realize that this happens all the time. And it doesn't have to happen. How many times have we been told like, this is just a normal thing that happens. You have to get used to it because you've had kids. Well, like statistics show us, and I can't remember, I want to say it's like 50 or 60% of teenage girls who have not had babies have incontinence, stress incontinence. Okay, right there, that tells you that we need a lot more education about it. So after that, I was like, this is just amazing. I went ahead and took the next 2 courses and got my pelvic floor certification. I love it. I love, you talk about some life-changing stuff that we're doing here. I mean, it just giving that person hope. It's like, it doesn't have to be this way. And we're going to fix it for you. We're going to help you feel, we're going to make you feel confident in the gym that you don't have to have this happen. Yeah. So that's kind of where it came in for me. And I love learning about it. There's so much great research that's coming out about it, which is super exciting as well. We're just, working on getting the education out to people. And, I said, I'm loving it now. Andrea, she probably is in the back there going, I told you so, but that's okay. That's all right.
Yeah.
So
I'm Andrea, and I've been a therapist for about 9 years. And I got into pelvic therapy about 6 years ago. It was kind of by accident. So I had a friend who had just had a baby. And so she was interested in taking pelvic floor course. Yeah. And I'd already lived here in Kingman at the time, and she's coming from New York. And the class is in Phoenix. And she's like, hey, can I stay at your house? And I was like, I'm a little far from Phoenix. So I was like, but I'll just take the class with you. And, it's something that had kind of been on my radar. Yeah. We'll take it together and, kind of see where it goes. The first day of the class, I had so many realizations. Like there were so many things going through my head, even about stuff in my life. So I have a history of Olympic weightlifting. Before I'd hit that 200 pounds, I would run into the bathroom, go void just in case, come back out. I have a history of like tension and pelvic pain as well, which I had always just dealt with, because never really knew anything else. And, I'd seen, how so many small changes that we could make, and so many things that were actually, an issue that could be resolved with such, small, simple steps. And, it was part of that realization with myself, being able to make changes in other people's lives, but such small educational pieces. So having done this, a lot of my classes 6 years ago, I've lost count of how many pelvic classes I've taken. And now getting to take this journey with Carol, with the Institute of Clinical Excellence. And, now I have this certification through them as well. There's so much new research that has come out in the last 6 years. This is such a growing field. Mm-hmm. And some of the things that I've learned back then, not that they become obsolete, but there's so much better research out now. We're able to help people so much more efficiently, especially in the fitness world. And there's so many changes even being made about, for example, lifting through pregnancy. This is like a huge area there's so much new research coming out, and we've restricted women for so long, and we've almost set them up for failure throughout the rest of their lives, because we're saying, here, for these 9 months, don't do anything. Don't lift more than 20 pounds, Now we're like getting in on the ground floor of things with all this new research, and it's been amazing.
Yeah. Really setting people up for failure too, because you think about, for all this time we say, don't lift. Okay. Then they have the baby. Okay. Now we're lifting a car seat and we're lifting a baby. Mm-hmm. We've like literally deconditioned women, which is how they're set up for failure. Then they do hurt themselves afterwards because they've gotten into this like deconditioned state, and dang it, it's our own fault. We did it.
It is. It's, even like postpartum, like when I did my certification for like postpartum and even pregnancy, of like lifting, doing CrossFit, it's like the biggest thing was like confidence that they can still do something, but there's always that more, and I hope it becomes less as this education brings itself. More of them are like, no, you just, no, because what if I do this? What if I do that? And it turns into a shame. Like if I work out, if I lift something, something's going to happen. And of course, something can if we're not doing everything. And I never want anybody to lift something or do something that they're questioning, because then we're going to hurt ourselves or something can happen. But the education was still not out there for them to be like, oh, I can. Or they'd be like, well, the elites do it. And I'm like, my rule is, if you've been running, if you've been lifting for this many years, your body needs it. If you stay stagnant, that's where we start to have those preeclampsia, that all those things that come into fruition that didn't run in your family or run in for you, because now your body's doing nothing.
Yep.
And then society also builds that up. Or my mom tattled on me to my OBGYN. She's like, she's still doing CrossFit. And he's like, well, how long have you been doing it? And I was like, oh, I've done it for 4 years. And he's like, good for you. Keep doing it.
Love it.
And
that's
it's
great.
Also like their education when they were, our moms or our grandparents are like, you shouldn't be doing that. And that shame comes in. So, and I feel like that's also with pelvic floor. Like it's shameful to talk about that still, which is crazy with how our society is supposed to be more open, but it's still so closed. So it's really awesome to hear that there's more and more education coming out.
Yeah, for sure.
So now that we've got your intros, what exactly is the pelvic floor and what role does it play in the body?
So the pelvic floor is just part of our full core canister. Like you mentioned in the beginning, the core is, if we talk about the core a lot, it's super important. And this is a piece that is sometimes left out, but it's part of our whole system. We have our diaphragm up at the top, our pelvic floor at the bottom. We've got our abdominals in the front, our back muscles in the back, and all of that needs to coordinate properly in order to keep things in, or, let things out if needed. So you can think about the pelvic floor as a door. So it can contain things, it can let things in, and it can let things out. It needs to be able to move up into the pelvis and down into the pelvis and allow for urine to come out. For intercourse, it needs to allow for, support of our pelvic organs. That's kind of how I would describe it. Would you add anything, Carol?
No, I think it's one of those things now, especially as a CrossFit coach. Dang, we need to be training people more on this, because not only, even if you're not having incontinence, by not, doing the right co-contraction or that type of thing, are we doing damage? Are you having pain? Like, there's so many other things that can come from it. I think it's, I'm trying to remember what the statistic was again. We go back to the education piece with our pelvic floor. Like, there's a good percentage of people that really don't even understand our own anatomy. Mm-hmm. It sounds shocking, but it's true. Like, people are like, oh, really? Like, I didn't know that. And again, it's just, we haven't had that chance to educate yet so that people understand that. But yeah, I love the core canister. And I love, we use an analogy of an A-frame house too. Mm-hmm. When we talk about how the pelvic floor can move up and it can move down, your pelvic floor should be kind of hanging out on the first floor. We should kind of be there most of the day, unless you're a high tension person. Like me and Andrea are both high tension. Yeah. So we like to hang out in the attic a lot and, working hard. But then there are times where we need to go into the basement. I think it's a great way to look at that. If you think of that A-frame house, like we need to be able to move our pelvic floor all the way up, and we need to move it all the way down, just like what Andrea was talking with our different functions of peeing, pooping, intercourse, having babies. That's a whole other position we get into. So, yeah.
Now that you kind of did mention that, where is the pelvic floor located and how does it differ amongst men and women?
So our pelvic floor is located at the bottom of our pelvis. So you can think about, if you have your pelvic bowl, that area where we, have our bowel movements, where we have urination, we have the muscles in that area. So basically the bottom of the pelvis helps to hold everything in. Men and women's pelvic floor they're very similar. There's one muscle in men and women that's different, where our vaginal opening is, that muscle is kind of split versus in a man, it's together. And then there's two urethra areas that are a little different in male anatomy, but for the most part, it's completely the same, and it functions in a very similar way. That if a male pelvic floor is weak, that's going to affect that core canister. And you're going to be a lot of times with men where we might see that there could be a pressure issue is hernias. We see a lot of hernias in men that happen either in the groin or in the abdomen. And that's because we're not getting that proper management, which includes the pelvic floor.
That's crazy. I didn't even think of that. When you said hernia, I was like, how do they figure out if something's going on?
Yeah.
Well, and you think too about it. So I have not delved into the male pelvic floor stuff. Andrea's taken several courses in male pelvic floor. We see it also after men who have prostatectomies. Mm-hmm. That's a big one, because they have to, everything needs to be kind of retrained to learn again. And you can make it super simple and just saying pelvic floor issues are pressure management problems. Mm-hmm. And you can think about males who've had prostatectomies. Yeah. We just changed a whole lot of pressure. Yeah. Right. Yeah. So, it's pretty cool.
That's wild.
Yeah.
Yeah.
That's just wild.
Yeah.
What are some common signs that someone might be dealing with pelvic floor dysfunction?
Yeah. So, we'll see a lot of different things. Honestly, we probably, as therapists, I think Andrea and I do more just because we're aware of it. But when we have a patient who has back or hip issues, we probably need to be screening. We need to be screening per pelvic floor. Yeah. It's yeah, right. I mean, it's really common. And, just a couple questions, and you're kind of like, we probably need to look at that too, but, we'll have people that have, they'll have like some random like hip pain, back pain, pelvic pain, pain with intercourse, pain with urination, urgency with urination, urgency with bowel movements,
Constipation.
Constipation. How many people have constipation? Like, it's just because I don't have enough fiber. Well, that's a piece of it, right?
Yeah.
But what has happened with that, So, what else? Am I missing something else?
I think that's kind of the bulk of it. Yeah.
Coming in for that now.
Right. Hey, I wasn't going to say anything, but I was like, the eyes looking right on you, girlfriend.
Yeah.
And I think what happens a lot of times, and we've seen this. I had a patient come in, and I think she ended up seeing Andrea. But when I did the intake with her, she said, I went, someplace else and told them I had this pelvic floor issue. They told me to do Kegels for 45 minutes.
That broke my heart. Yeah. That was just so.
Here's the thing. If I remember correctly, she was a high tensioner.
High tension. Yeah.
So we took somebody like me and Andrea and probably a lot of people who their pelvic floor is up in the attic, like a lot, and be like, okay, just keep it up there. So it's like, let's hold a bicep curl for 45 minutes. Just hold it. Just keep doing. Yeah. And so this,
no wonder you can't straighten your arm after that.
And then you can't straighten your arm. Right. Yeah. So she came to us, gosh. And these are the ones, and I think this is what has created the passion in me is you are making such changes in these, like, these are like life-changing things. I had a lady who had not been able to have intercourse for, I think she said 14 years.
Wow. Oh my God.
Because she had severe pelvic pain. She was high tension. She had some other issues too. The doctor's solution was, well, if that's what hurts, then just don't do it. And I mean, gosh, darn it broke my heart because it doesn't need to be that way. Or we had another patient who had pelvic pain for years,
40 years,
Yeah.
I think. Yeah. I mean, it just, and why did she have to wait so long for,
Well, that, and here's the other thing that I want to like hit people upside the head. And I think it was her, all the stories run together after a while, but so many women are told, it's just in your head, or you just don't love your husband. Okay. I'm sorry that I'm going to call BS, like real big time on that. Yeah. We do this to people and make them feel like guilty and terrible that there's something wrong with them. Mm-hmm. And the great part for me and Andrea is we can do like a couple little, probably, honestly, I would say in 15, 20 minutes, we can probably change their life. Mm-hmm. I mean, it's some little changes like that. And, we use the term, and I love this, words can hurt or words can help. Mm-hmm. I think that's the coolest thing in the world, right? Do we empower people by shaming them, or do we say like, hey, you know what? We can, this is a real thing. Like we can, especially when we do an internal exam, it's real evident, like what's going on, a lot of times. And, there's so much, there's fear, there's shame, there's all this just nasty stuff that goes with it that doesn't have to be there, know?
Yeah. Yeah. I think I just worked with somebody recently, they had stopped exercising completely because they had been told, their insides were going to fall out because of their prolapse, and that they were going to make things worse. And again, we're deconditioning people, especially we end up maybe prematurely doing surgery for these patients. And then the surgeries are failing because they're never taught how to properly coordinate with their pelvic floor. And there's still that abnormal pressure there. And they're, it's in just by, an evaluation, I'm able to, really encourage people and get them to not be so worried about, injuring this area of their body and that their organs are going to fall out, and, make a couple changes and saying, it's okay. We can get you back to exercising. We can get you back to lifting. You don't have to, restrict your life and live this way. And, we are conservative management people as physical therapists. And if we can avoid a surgery, if we can, get you on this journey where you're empowering yourself and you're able to move better and you're not worried, and I think a lot of times, like Carol said, words can hurt, and we can really scare people into not wanting to do anything out of fear.
And public service announcement, your organs are not falling out.
Right.
That is not what's happening, but that's what people think. I mean, the amount of times people come in and they have prolapse and they're like, things are falling out. Like my uterus is going to fall out. It's like, no, it's not going to fall out. And actually, and it's on an aside, but again, I kind of geek out with some of the research. We're now doing some new research that's showing that what we used to actually call prolapse, which would be like stage 1 or stage 2, that's prolapse. That's actually normal. Like that's normal.
Oh, wow.
Yeah. Stage 1 and stage 2. I mean, if you've had a baby, I mean, it's kind of like you just went and ran a marathon. Like, do you think your tissues are going to look phenomenal after that? No, there's going to be some laxity there. So yeah, I think there's so many cool things that are coming out with that. But yeah, public service announcement, your organs are not falling out. And it's not that we're not anti-surgery. I mean, it's just like, it's like a back or any other body part, right? Like who would be like, Blake, you have a back issue. Let's just do surgery. Let's not try anything else. Like what? Like some people want that, which they're crazy, but no, like let's try it. There's so many conservative things. Now, do people sometimes have to have surgery? Yes, they do. But shoot, I would like to try everything conservative we can prior to that. Cause once you've had surgery, it's not your same setup as it was, right?
To me, it's just like for surgery, when we go to that first, like when they have surgery for prolapse, like I didn't learn anything to better when I get out of it. So I'm going to do it again and it's not going to change anything. And we're just going to be in this never ending. But then to go back on like all these examples of women, and I know Joycey's doing the men versus women, but it's just so much that's in our brains as little girls and growing up. Like I seriously, when I was growing up, I was like, okay, well, when I have a baby, everything's going to fall out. Or it's just like, what if I get this? What if I get that? And they're like, that doesn't happen to everybody. And it can. And if it does, I was also during both my pregnancies around women who CrossFitted and told me everything and were like, hey, there's these options. And I know that's just a small percentage because we're fed into like, oh, if you do that, if you don't like have sex with your husband, if you don't do that, if it hurts, just, you got to get over it, or you had a baby, you can deal with pain. We deal with pain a lot, whether we've had babies or not. I feel women can harness like, okay, I can get through this. Not saying men can't, but we just go through so much more in society of the shame, the lower the confidence, and just deal with it. Adding this on top of it is just, crazy that people just walk through it 40 years, 17 years, like walking through life for these things that lowers your self-esteem so much. That's crazy but saying 10 or 15 minutes, you're starting a game plan for them and telling them, okay, there's a light at the end of the tunnel is just amazing.
It's super cool.
Yeah.
I had some question, like a follow-up question on the red flags. Like, how does that translate, like, at the gym? You had mentioned, somebody was lifting and that kind of happened. Like, how do we see that translate into the gym? And then I'm also very curious to know, we talked a little bit about pregnancy. We talked about lifting. Like, is there a difference between, like, the pelvic floor of someone who's been an athlete for some time versus maybe someone who doesn't exercise? Like, is there, like, a difference in strength of the pelvic floor?
So that's a big question. I mean, I think, how does it translate? So I feel like, and again, this is coming from a coaching side now, which I love that like my world has kind of collided with CrossFit and coaching and therapy. And that's the coolest thing in the world. But we have to, in the clinic, we're teaching it. We're teaching, Andrea and I teach probably core stuff a good chunk of our day with a lot of our patients, right? I think when I'm coaching, I've kind of started, I leave a little time and sometimes my classes run over because of this. Anyway, I feel like we have to teach people how to brace correctly. Because how many people are taught like, okay, if you brace, suck in really hard. Okay, suck in really hard and try and lift some weights and walk around. Yeah, it's not going to last long, right? Or push it out really hard, like that. That is not going to work right? And so we have to teach the right way to do it. And I kind of use an analogy. I've been kind of liking this because I think it helps people is I'm going to brace my core. Once I know like how to brace properly, I need to know how to turn up the volume or turn down the volume, right? So if you think about it, if I'm going to go deadlift 300 pounds, which I can't, but if I was going to deadlift 300 pounds, I'm going to use a whole different recruitment strategy than if I'm going to bend down and pick up a bag of groceries, or I'm going to bend down and pick up a 2-pound dumbbell, right? So if we go into it, and this is for us high tensioners, if I go into every contraction as if I'm lifting a 300-pound barbell, holy cow, it's not going to last real long, right? But we have to learn. Now, let's say I'm going to go on an hour run. I need to know how to keep that low volume and sustain that so that my pelvic floor is supported and I'm managing the pressure properly. Or you think about a double under. Again, another really common time. If you're under high tension and you have to do 100 double unders, I'm sorry, but things are not going to go so well, right? So we have to learn how to, like, what is the volume that I need to keep things from leaking, but not overdo it. Like I don't need to go into it with like the 500-pound pressure. I just need that light pressure and then I can maintain. So I think that's a big piece of how I'm using it in the gym. And I think, I will get some people that will come up and we'll talk about it. But again, it's that whole societal thing. I mean, we're still afraid, and Andrea and I need to do another in-service just to get it so that people do realize, like, hey, let's talk about it. Like literally there can probably be, I can think of like 1 or 2 cues I might give somebody that would like dramatically change things, So I think, it's just doing that more and feeling comfortable with saying, actually, it was really interesting that this morning after class, there was a group of women. I was filling out the whiteboard for my next class. There was a group of women that were kind of sitting around afterwards and they were talking about it. And I'm like, yay, this is good. Talking about hormones and talking about, menopause and talking about how things were when they were pregnant. I'm like, this is great. This is what needs to happen. And I forget what the other part of your question was. So we talked about the gym and how it carries over.
And then how does the pelvic floor differ amongst like athletes versus maybe non-athletes, or just the people who don't exercise?
Yeah, there tend to be some tendencies and patterns that we see. So I think with athletes, we do have a higher tendency to see some higher tone patients, just because of how we're lifting all the time and we're bracing all the time, and they are sometimes not the greatest at getting down into the basement. And
my hand is raised.
The double under
300 pounds. That's what I thought. Like, oh, it didn't last.
Right. Yeah. And we're maybe doing that 300 pounds, like when you're picking up that grocery bag.
Yeah.
And then, so that's where we're seeing a lot more of our stress incontinence, our leakage with lifting and with double unders and things like that, because our athletes tend to be a little more high tone. So, we'll see weakness in both our athletes and our people who don't work out almost very similarly, because when your pelvic floor is all the way up in the attic, you also can't really squeeze further, so that strength is actually not really there like it should be. Yeah. Probably another difference between the two would be just bulk and volume. We might see with somebody who is not athletic, maybe those tissues don't have the same, blood flow, the same, muscle bulk. And maybe we're working on getting better recruitment in that pelvic floor. But a lot of times, sometimes they present very similarly, and sometimes maybe the non-athlete has maybe better range of motion than the athlete. Yeah,
and maybe CrossFitters versus other exercisers.
Yeah, like maybe Pilates, yoga.
We just tend to be a little bit, cut from a different cloth,
right? Yeah.
So since we're kind of piggybacking off of that, what about pregnancy and postpartum athletes? What are some of the biggest changes during pregnancy that can cause, or biggest changes in pregnancy that cause towards the pelvic floor?
Pregnancy has kind of been, I've been taking some additional coursework with it right now. So it's been part of my passion project. I've been taking some nursing courses and some doula courses and stuff to help better prepare people for birth and through their pregnancy. And again, one of the biggest things that have been coming out for pregnancy is, yes, well, one, if whatever you've been doing, usually you can continue doing. But even if, let's say you're the person who just recently got pregnant and you're not an athlete, but you want to be stronger for your pregnancy, you want to be better through your pregnancy, you can still maybe do things that you weren't doing prior to being pregnant with the proper guidance, and you can get stronger in pregnancy. We might have to make some modifications, like with like hipping pull-ups. We might have to make some changes because there is more tension through the abdomen, especially, in your, towards the end of your second and into your third trimester. We might have to make some changes in the mechanics of how we're lifting. But, we want to take where people are at, or maybe even make them stronger to prepare them. Cause birth it's a marathon. It takes a lot of effort. And I think some of the research is showing that because we have less fitness, that there are these higher rates of C-sections, and there are these higher complications that are occurring. Now, of course, we don't know what's going to happen. You could have the most amount of education and preparation, and things can still go wrong in birth. And I think part of what we are doing now as pelvic floor physical therapists is preparing people for all of the options. Just saying like, if this happens, we can try this, we can do this. And just I think the more people are prepared for what might happen, we're reducing the postpartum depression, and we're reducing, having a harder time getting back to where we were before. Also getting patients in sooner after they've given birth to just kind of guide them through that first period of time. Like, even if you've had a C-section, you still got to take care of your baby, and you still got to lift your baby, and you still have to know how to even do some diaphragmatic breathing and just start to get some type of activation through your abdominals and through your core in order to do life. And, did that answer your question? I think I kind of went on a tangent.
No, it was, I feel like it was really good. And it was, whether it was or not, like, okay. It was really good because when I had both of mine, it was right after, just don't lift anything above, 10 pounds. And It's like, part of that, like, my husband didn't have time off for my daughter, and we were in the middle of moving. So here I am with a toddler and a newborn, and I do have to lift things and try it mechanically, and I didn't have anybody around at the time. So it's like, okay, so I'm supposed to keep lifing, but I can't life right now.
Yeah.
This is good for me. I feel like just having that and then coming in and making it one of the check marks of like, okay, you need to go see this person and see how it's going, just adds on to it. And then because you're in a one-on-one setting, answering those difficult questions compared to when you see the doctor and they're like, okay, how's this? How's this? How's this? Okay, you're good. You have this new baby. Good job. And then everything's also about the baby, right? We go to appointments that are just, okay, how's the baby doing? How's this doing? Are you doing good? Okay, good. The baby, it's, which is fine. That's what is important, but it's also the mom's health. And when I was pregnant with Weston, I had about 16 or 18 other moms that were pregnant with me that I knew throughout college and high school. And part of the family. So like, we literally had a massive text message after everybody had their baby. How are you feeling? What does it feel like? What are mommy blues? What are this? How is peeing? Is everything okay down there? What happens after that? And again, I feel like if we had more of the healthcare doing that for us too, it felt more relaxed to just talk about it and be like, you know what? No, it's not okay down there. I am that one that's not okay. What do I do? Compared to, oh, well, that didn't happen to me.
Right. Well, and I think that's what's really nice. I mean, if we are lucky to get somebody, to see them at like, 34, 36 weeks pregnancy, and we start having those conversations because you're right. Like, nobody's really talking about the mom that much. They're talking about the kid, which is important, right?
Oh yeah.
But I mean, we even are seeing people, just a couple weeks postpartum, where again, we have the time where we can say like, okay, how are things going? How's your blood pressure looking? How are you healing? How are your incisions? Oh, this is normal. This is not. And if we can, even just having that conversation, you can think about if somebody just said, I mean, cause we don't know, nobody's teaching us like, okay, they teach us how to care for, like, say, an episiotomy or a tear. But beyond that, they're not like, well, okay, well, X, this is normal. This is not normal. How many women, and I'll tell you it's a lot, have a lot of anxiety about that because they're like, I don't really know, like, is this normal? Is this how it should be? And we can be that person to help them. And, maybe that does help them from, having some of the postpartum blues or anxiety about, there's enough anxiety as it is afterwards when you have a newborn, especially your first one, that, if we can relay some of those fears and be like, nope, this looks good. This is normal. It also gives us that chance to say, you know what? It's probably good to check in with your doctor. And we have the expertise and the time to do that, which is what's really cool.
I think it would help 100%. Just thinking about what I did, even though I had like some support, it was still like I didn't have like somebody who is knowledgeable about it. And then again, like literally asking me like, how does it feel down there? And me being like, well, I don't know. It doesn't feel like my old self, but I hear that's okay. Mm-hmm. And that's usually what we hear. Like, it's never, ever going to be the same. Mm-hmm. It's okay that it's not the same. You just get used to it because now you have a baby. Mm-hmm. And if I had a difference about it, even with after my second, it would still be so much more knowledge because it was just like after my second, it was the same thing. And it was a different state. It was just, now you have two. It's going to be even more different. You'll be fine. You'll just get used to it again. Hold your pee. If you can hold your pee, you're fine. That was a big thing too, that I was like, hold my pee. Okay.
Maybe you should have done 45 minutes of Kegels. Yeah. Maybe that would have helped.
If you can like make what is it, like a symphony as you go pee, stop, go, stop, go, ding, ding, stop, go, things like that. I was like, no, I don't know. Like and so like hearing these things, I feel like if beginning pregnancy, during, after, like need to be for us.
Yeah.
So it's really cool that you guys are continuing education. There's also people out there doing that and bringing that, presenting it out there. Mm-hmm. Going back to for postpartum. So for athletes who are coming back, what should athletes know when they are returning to workouts after having a baby for the pelvic floor? Like maybe some common mistakes that they might have had, or rushing intensity, things like that. What are some things that they need?
Yeah, I think it's very individual, just like in anything else, right? It depends on the training they had beforehand, the training they get afterwards. And it's really, again, the pelvic floor is a muscle, right? It's a muscle like everything else. We wouldn't take a fresh, quad after surgery or something and be like, let's go put 300-pound squat on that. We wouldn't do that, right? And I think we have to, that's where that really like thorough assessment comes in is, one, what is the mom wanting to do? Where's her head at right now? Was she, an avid exerciser and she got the message of, you can't do anything for 6 weeks, or you can't, I think we have to look at that. And is it safe to exercise for some people before that point? Heck yeah, it sure is. Are there other people, maybe they had some complications? So it's really individual. And I think we have to, that's what that thorough assessment comes in, is we can see like, what's the pelvic floor doing? What was their fitness level prior to? What is their desired goals, and how can we get to that? Because we're doing the patient a disservice when we don't take that into consideration, right? If I'm like, okay, I want you to do X and X and X, and they're like, but I really don't, that's not even what I want to do. Or give them the why. And I like that piece too. Like, hey, we're going to start with this really low level of whatever, teach you how to use your core. Now that things are a little bit different, so that we can get into eventually getting to kipping pull-ups or, something like that. And we didn't really talk about it too. People that maybe have diastasis recti. We have to think about that too. And that's we could have a whole other podcast on that, as to, this fear of, oh my gosh, you've split open, and you shouldn't do anything. And holy cow, again, that's a whole other podcast, but educating women, really, it's educating. Okay. Finding where they're at and taking them from that point. Is there some stuff they can do fairly early on? Heck yeah, absolutely. So, yeah.
Yeah, definitely very individualized for sure. So it's hard to say, the I think one indication would be like if you weren't bleeding and now all of a sudden you're bleeding, maybe that's a sign that you're doing too much and to scale back a little bit. Like, I think, and some people don't have great awareness of their body, but listening to your body and, easing back into it, and just kind of slowly grading yourself back up. Maybe you start more very scaled and you start, testing yourself and going a little bit more up from there. But yeah, with that assessment, we can, say exactly where you're at and focus on where your goals are based on what we're seeing. And yeah.
Does age play a factor in just the pelvic floor?
The older we are, the smarter we are. That's my story, and I'm sticking with it.
There we go.
I mean, I think just like anything else, it is going to be really individual. What has the person done training wise up to that point, right? You could have somebody that's very young that has no clue how to manage pressure, and then you could have somebody that is older that does know, and it would be a very different looking type of thing. So yeah, I think, and I feel like in my opinion that, our tissues maybe could be a little bit different as we get older, but how we manage them is still going to be pretty consistent.
Yeah. Yeah, absolutely.
So we've gone over everything. Now you guys keep talking about like the initial appointment or things like that. What are the beginning steps? Like, coming in, what does your first appointment look like for the pelvic floor?
We chat for quite a while on our initial evaluation. So we take a very detailed history and really we're looking at your goals. We're figuring out what you feel your problems are, because I can assess your tissue and take a look at what's going on. But if it doesn't match the problem that you're having, then it doesn't really matter so much. So getting a really good background on what obstetric history you've had, what's going on with your back, what's going on with your hips, surgeries you might have had, even surgeries unrelated to the pelvic floor could make a difference. So getting that history is probably the most important thing we do. When I first started doing pelvic floor therapy, I had 45 minutes to do an evaluation, and I think I spent the entire 45 minutes just talking to the patient. And it was great, and the patient got so much information out of it because there's so much education. And then I'm like, what am I going to write down? Because I didn't look at anything. And and then I realized I'm like, I have so much information. Even so, it's just a lot more about your experience. And sometimes, we usually do a pelvic exam, because that pelvic exam is able to a vaginal exam or a rectal exam, depending on men or women, or sometimes it's needed to have a rectal exam for women. That information from that exam tells us exactly what's going on in the pelvic floor, but it is not absolutely needed. And if somebody is not comfortable with that internal exam, we can get so much information from hip range of motion, hip strength, back range of motion, from your subjective history, that I can almost tell you what's happening in your pelvic floor without having to do an internal exam. It's helpful because I'm not doing educated guessing, but it's not absolutely needed. So a pelvic floor assessment is a PT exam and assessment. And it's just this added layer that we're looking at.
I think the other piece too, a couple of different things. One is, depending on our audience, when I'm looking at CrossFitters, they may have, it may take a much higher level of exertion to actually see the problem. So we may do our quick supine evaluation, but then we'll also take people and we'll do an internal evaluation as they're performing maybe a squat or a deadlift. Tons of great information from that, because maybe if they're laying on their back and you can see they've got good range of motion, but every time they do a heavy squat, they can't keep their urine. Okay, well, let's do an assessment. Let's see what's happening when we do a squat. Is their pelvic floor staying way up at the top the whole time and they can't maintain that range? What's actually happening? We get a ton of information from that. And then I think too, just to top off of that, we continue to get more information as we go. And I think people kind of think about things like maybe we say something around and then they come back the second time and they're like, you know what, I was thinking about what you were saying about that. And, I had an appendectomy when I was 5 or whatever. And I had some scar tissue there. Do you think this could affect it? Yeah, absolutely. Or the other thing, and I love my other thing I love to geek out on is nutrition. It's really interesting to me. Holy cow, nutrition has a lot to do. And we can, especially when we talk about constipation, we talk about
even urinary pain,
yeah.
Mm-hmm.
There's a lot with nutrition. So we kind of get to geek out on nutrition stuff with people too, and overall getting them healthier. Hydration. It's another big thing. How much you drink, when you drink it, are you up peeing 5 times in the night and you're drinking, a half a gallon of water at 9 p.m. Well, that may be a problem. Something we can change. Right. So yeah. So again, we have to kind of look at that person really specifically and what their needs are to have the best evaluation. But it's a lot of questions to start with.
Mm-hmm. Yeah. That whole urination piece, I think it popped up in my head. So many people restrict their water intake with, trying to, go to the bathroom less, to try to leak less. And they actually make the problem worse because the more we have a higher concentration of urine from being dehydrated, the more acidic that bladder becomes. So just having somebody work on getting a couple extra ounces of water in each day and starting to bring that up can actually help to reduce some urinary symptoms.
It's making me thirsty just thinking about
right?
it.
Where's my water?
I know. That's exactly what I was saying. I was like grabbing my water bottle.
Yeah.
And I think we have to be really good at being our own advocate. If you think that you've got something going on, you're not sure, and talk to your primary care provider and just say, hey, hey, I know this place called Inspire, and they have pelvic floor, would you write me an order for that? And if they say no, shame on them, go find somebody else that will, and there's just a handful of insurances that do require, you to have a referral from a doctor, but we see I don't even know the percentage. We see a lot of people that just, they go to our website, they see that we do pelvic floor therapy. And I think I had like 3 calls this week of people that just said, hey, I heard about you guys and I've had this issue. Can you help me with that? And, a lot of our pelvic floor self-pay patients that they don't even deal with the insurance. They're like, this is something I want to do for me. And, it's nice that we have that availability to do that in Arizona, being a direct access, unrestricted direct access, which is, again, we could talk insurance for a whole other podcast too, but that'd be super boring. But yeah, you can seek out care for yourself. I think it's really good that we can do that. There's access out there. You just have to advocate for yourself for it.
Yeah. Yeah. And I always like to, kind of remind my patients, especially when they're coming in, in these situations where they're frustrated. I know sometimes, they blame their doctor, and I always remind them I am so lucky in my job that I get to spend 45 minutes or an hour with you and they get 5 minutes. Mm-hmm. And so much of this is education, and how much can you educate your patient in 5 minutes, and it's a system that's a little bit broken, and they're just trying to live in it and do the best for their patients. Yeah. And that's what we're here for, is to, be able to spend that time, they refer you to us and then we take it from there.
I was going to ask, what are, I guess, some little things that the average person can do, I guess, to help their pelvic floor?
Come in to see you guys first.
Right? Right. Part 1. It's kind of a hard question, honestly, because everybody is so individual, right? I think learning how to, don't Dr. Google it, but, learning how to brace your core properly. And I think it gets trained wrong a lot of times.
Yeah, it's hard.
Yeah, it really is. And I think that's where it's nice to have that one-on-one, I need to put my hands on, I need to be yes, this is right. And then I have them feel it no, this is the right way. Mm-hmm. Even with how we put a weightlifting belt on and how we brace with a weightlifting belt, it's different, right? We have to, I think we have to teach people on doing that as well. I don't know that there's a one size fits all. Is there a higher percentage of people that have high tension than low tension? Yeah, absolutely. So if somebody tells you do Kegels for 45 minutes, that's probably not the right answer, right? I think getting in, if you have concerns and you have questions, I think either talking to a pelvic floor therapist like us, or being that advocate for yourself of, hey, I want to seek out that care to just find out, is this a problem? Is it not a problem? But I think some real like low hanging fruit, everybody can do this, but especially our pelvic floor patients, good posture. Posture plays a big piece. You can imagine if you're really slouched in the chair, what's your core canister doing? It's like, right? It's all crumpled in. So having good posture allows us to most effectively use our core canister the best. So that would be the low hanging fruit for me, is like, we need to fix our posture. We're a bunch of slouchy people, right? That has a big effect, right? Yeah. On our phones and all that kind of thing.
Yeah.
So
I think breathing too is,
yes.
I'll have somebody, I'll tell them, okay, like, take a big belly breath in, and I see no belly movement, and it's just their chest is like up at the ceiling. And, so I think just working on, taking better breaths, breathing and letting your belly be soft, just letting your chest down and relax and your shoulders away from your ears, going back to posture. If you can take a fuller breath, a nice, soft and relaxed belly breath, I think, like Carol mentioned, a lot of people tend to be a little higher tone. And if you can take a better breath and you can breathe better, I think that is, one of the easy things that you can do.
Yeah. And I think another thing too is, I love to work on like meditation with people. It's, again, those of us that are the high tensioners, we need those kind of down regulating kind of things like meditation and relaxation. That makes a huge difference. You kind of, I think a lot of people almost are able to be more aware of what their pelvic floor is doing when they're in that state, because they're taking that time to relax. So yeah, I would think that'd be another great piece.
Where can people find you to make an appointment?
So we're located inside of Kingman CrossFit, which is at 4165 North Bank Street. So our office in there, it's a very private office. We're sitting in it right now. It's newly renovated.
It's so nice.
By me and my husband with blood, sweat, and tears over the weekend, and very private. So yeah, we're right inside of Kingman CrossFit. You can call us. 283-551-7651 is our phone number. And that will come to me. And usually I just kind of ask a few questions. We talk insurance, that type of thing. The other thing you can do is you can email me at inspirekingman.com is our website. My email is inspiredr, Carol, Carol, at gmail.com. So you can either email, you can text, you can call. Some people will try and stop in, but we're treating patients most of the time. So getting a hold of us, one of the other ways would be great. And even it's just to say, is this something that you think I need? Would this warrant having me come in? And we're happy to talk to anybody, and see, we can easily talk for plenty of time about the pelvic floor. So happy to help people out.
Nice. Is there anything else you guys wanted to add?
I think it's don't be afraid to ask questions. You know what? We're doing our best, but we're just two little therapists out here in Kingman, Arizona, trying to do the best to educate people, but be open to it, even though it's uncomfortable, and know that it's most likely something that we can have some type of an effect on. It's, it's not something, don't be ashamed, don't be afraid, don't be scared. We're here for people. So we just want to help people.
Yeah, agree with that.
This was such a great conversation, and honestly something we think more athletes need to hear. So thank you to both of you. If this episode was your swig of pre-workout, please let us know. Hit those 5 stars. Give us a review. Do all the good stuff. But if this helped you, or know that this will help someone or can benefit someone, please share it with them. We don't share enough about these things, and I feel like this is a great topic to start with. And if you have a topic that you want us to dive into, or you want to be a part of our affiliate segment, please feel free to DM us on Instagram at SavagellyScaled or email us at SavagellyScaled1@gmail.com. And remember, don't be a Karen,
Be a Sharon.
and keep sharing until
We meet
at the whiteboard again. Bye.